6 most important treatments for osteoarthritis of the knee. This is Dr. Hatem Eleishi. I'm a professor of rheumatology at Cairo University in Egypt. What we present here is a series of videos about the different types of arthritis and how to manage them. Before we start, please don't forget to subscribe to my channel and activate the notification button. You will receive notifications of very important videos that will help you with any kind of arthritis. Number 1, instructions. Your doctor will give you instructions on how to do everyday tasks with the least stress possible to the knee joint. Following those instructions is important to maintain your knee and to postpone measures like knee replacement over the years if you are having more severe types of osteoarthritis. No other measure ranks higher than instructions for the knee in importance. There's a WhatsApp number at the bottom of this video through which you can request the list of knee instructions that we send to our patients from our center. Number 2, weight control. You will need to gradually lose weight if you are overweight or if you are obese. Number 3, physiotherapy. Now, you will benefit from a program of physical therapy. Typically, it consists of machine modalities and exercises. Machine modalities include ultrasound, infrared, and laser. For example, they are good for pain relief over the short term, days. Exercises and mobilization in range of motion and stretching and strengthening exercises help reduce the pain and also restore the healthiness and vitality and strength of the knee joint over the longer term, over weeks and months, especially if you follow this with exercises at home also. Number 4, prescription of medications. We will also prescribe a painkiller for you to use when needed. Painkillers are not treatment plans. They are only painkillers. There are also medications that supposedly stimulate the cartilage of the knee, like glucosamine, chondroitin, and that stuff. They may benefit some patients as well, but not to the extent that matches the big publicity they have on social media. Number 5, local knee injections. There are 3 types of local injections that can be used for patients with osteoarthritis of the knee. Before prescribing any of them, it is important to request a plain X-ray of the knee joint to make sure that the osteoarthritis is not too severe and the cartilage is not completely worn out, as patients with such advanced degrees of osteoarthritis will not really benefit from local injections of the knee of any kind. The first type of local injections is intra-articular cortisone injections. We use a cortisone injection if the joint pain is severe and intense and maybe even disturbing the patient's sleep. The intra-articular cortisone injection here is a powerful anti-inflammatory medication that can give a temporary relief to the patient until other measures of treatment have taken over, like the instructions and physical therapy and the like measures. The second type of local injections of the knee is hyaluronic acid. We call this process viscosupplementation. Hyaluronic acid is a thick fluid that kind of lubricates the joint or revitalizes the joint cartilage tissue to increase the longevity of the joint in those who are candidates for the procedure of viscosupplementation. The third type of local injections of the knee is the plasma injection, which we call PRP. Although plasma injections, PRP injections, are currently being used for some patients with osteoarthritis of the knee in some centers, yet there is no research confirming that they result in a significant rebuilding of the cartilage of the knee to an extent that parallels the reputation it is gaining lately in dealing with this disorder. Its use is more promising though in acute injuries like sports injuries. There are many undergoing studies that are trying to find a treatment that can really rebuild cartilage. However, none of these studies have so far reached a really conclusive treatment for that purpose yet. Unfortunately, there are some non-professionals who claim that herbs and bee venom can rebuild the old cartilage. This has no scientific basis, regardless of the wealth of data you will find about them on the internet. Herbal preparations and bee sting are, at best, painkillers only, but of questionable safety. Number 6. Number 6, this is the last one. Finally, for patients whose osteoarthritis of the knee has progressed to advanced stages diagnosed by the severity of the symptoms and the plain x-rays of the patient, we refer those patients to an orthopedic surgeon for replacement of for surgeries, some kind of surgery, and the most important of them is a total knee replacement. I hope you found the info in this video useful to you, and you already know now what kind of plan your doctor will probably make to manage your knee symptoms if you have osteoarthritis of the knee. Thank you.